Thank you so much. It's a real pleasure to be here, and a pleasure to be back and see all old friends, and a pleasure to acknowledge QPath, because I was on one of David Rim's projects looking at Key 67 with QPath, and it works brilliantly, and I'm looking forward to really digging in. And speaking of digging in, why don't we dig in? The talk that I'm about to share with you is not just about MUSE, which some people of you have already heard about. It's a new slide-free approach to histology, which has a lot to offer in terms of speed, but also preservation of tiny biopsies. You've heard about that as a problem because it's a way of looking at biopsies without destroying them, so they're all still there for DNA and RNA. And you don't have to be in formalin, so you don't have to worry about formaldehyde problems. It's actually very accessible, not only to people in major medical centers, but as I'll show you, it works. High school students can do it. I have some nice images taken by high school students. And it should also be a globally significant way of making cancer diagnostics possible in places that have no histology laboratories. So, but I also want to bring on two new technologies to show you, which is very exciting, and then close with a section on artificial intelligence that turns out to be surprisingly challenging in a challenging way. But one of the things that I think has already been touched upon is that there is a lot of information in the slides. We've heard about sort of morphology maybe trumping molecular. And so instead of saying the truth is out there, I would say the truth is in there. And there are different ways of getting at the truth. But one of the ways may or may not be H&E. So remarkably, this is the Ngram viewer. You've already seen it once. But this is looking, instead of this huge burst of stuff on AI, is what's happened to the mention of eosin and hematoxin over time. It starts around the 1870s. And peaks in the 1900s, and then again in the 1960s, beginning to peter out. And I wonder what we can learn from that. So there are alternatives to H&E, and I'm going to show you some, but also ways of getting more information out of H&E. And so this is the talk I hope to get done in a timely fashion. So first I'm going to show you some stuff on MUSE, which stands for microscopy with UV surface excitation. And then SciCam, which is our new technique for pulling out collagen information from H&E stained slides. That's originally stood for, and this is true, stupid collagen imager, but now we say simple collagen imager. And then I'll talk about AI and a success, but also some really eye-opening cautions. So I have a disclosure. There is a company formed to bring MUSE forward, and hopefully that will happen. So this is the slide now, a challenge for all of you. This is the first of the hopefully tiny genre of telepathology jokes. So the question is, why did the pathologist cross the road? No? To get to the other slide. Thank you very much. I'll be in this room all week. But pathology has problems. It takes a long time with conventional equipment to get from the procedure to the answer, and the reason is not that the pathologist is slow, it's the slide is slow. But we still need slides because we're still using state-of-the-art equipment as shown here. It's a challenge. Nothing, everyone laments this, but nothing has really happened in mainstream pathology for 150 years. So what would be nice is to have something that has other properties. It would be nice if there were alternatives to standard pathology, and there are lots of alternatives out there that you've heard of, perhaps two-photon microscopy, optical coherence tomography, structured illumination microscopy, lots and lots of these things. But what you really want is something that's very simple, very inexpensive, user-friendly, and you can see the friendly user right there. And ideally, it would also be good if it were global and democratize this. And so we've stumbled on, or I was given from someone who had developed the original technology when I came to Davis. He said, check this out. And it seemed like a good idea. So this is what he told me about, which was that light at UV wavelengths, when it hits tissue that's been stained for a few seconds in a fluorescent stain, only penetrates the tissue a few microns. And so you get the thinness of a glass slide without actually cutting the tissue. You just look at the surface. And of course, the surface is defined by you. It's wherever you cut, so you can define what you're looking at. And then the emitted light is collected by a standard microscope objective and goes into a standard color camera. And so you can see that it doesn't have any exotic optics. It's instant. In other words, you get the image directly. You don't have to compute. And it's even battery and cell phone compatible, so it could be used anywhere. So here's the workflow. This is how we do biopsies at UC Davis. And then you do FFPE, which stands for formalin fixed paraffin embedding, or embedded. And all these steps. And these steps take time, toxic chemicals, and skilled personnel. And at the end of it, you get a slide that looks like this is colon cancer. Or you can do it the MUSE way in just 3 minutes, and you see something like that. And the guy who made it all possible in my lab is shown here. That's Farzad Faradouni. And I'm hoping to advance him to assistant professor at UC Davis, so that's ongoing. But that's him working with his the instrument that he built, which is just this little tiny thing in the background. It can be very small. So how does it work? As I said, it relies on the principle of not fancy optics, but simple tissue physics, which is that light at different wavelengths goes into tissue different depths. And this is a model of skin and light from 755, which is far red, all the way down to 420, which is blue. And you can see that the depth of penetration decreases dramatically. But even at blue light, it's 0.1 millimeters, which sounds like not a lot, but that's 100 microns, which is 20 times thicker than a typical slide. So you have to go even further down, and we ended up at 275 or 280, and I'll just show you the impact of moving there. So this is a slide. This is the wrong way of doing it. This is exciting a piece of kidney in blue light, 405 nanometers, and you can see sort of structures, but they're vague. And then if we just switch from 405 to 275, that's what we see. So much sharper, and that is the same field of view. So that's the depth thing. And the other thing that's really nice about UV is that unexpectedly to me, lots and lots of dyes can be excited at 280. And so what you get is a very long Stokes shift, which means that instead of having a different excitation source for every different color, you can use one source and lots of colors as shown here. So one LED will excite all of these different dyes, and they emit in the same wavelength that you normally expect. So the TAPI is blue and rhodamine is reddish, and it's good. And that's why we can use a color camera and a regular lens. So we built some prototypes. These are big and stupid. They're going to be half the size and smart. But they do work, and they can work. Even this one can do 5 by 5 centimeter field of view at 10x resolution. And we're going to make one this big, so we can do whole organs. So this is an image, a typical image, and I mean that sincerely, of MUSE image of kidney. And it was just stained for 10 seconds and then washed for 20 seconds and then plopped right on the stage. And this is a blood vessel surrounded by blue collagen, and the tubules are collecting ducts up at the top. And if you look closely, you can see a really nice depiction of the internal and external elastic laminae, and those are nuclei of the smooth muscle cells. And then down into the vessel, you can see the endothelial cells. And so we don't need a special stain for elastin, it just comes for free. Now, pathologists are boring, and they're not excited by looking at colors like this. So this is what the camera actually sees, but they insist for some reason, and I'm a pathologist, that we convert it to look like H&E, and so we have a quick tool in the software to do that. But as I'll show you at the end, it's not very good, and we've enlisted AI to do a much better job of mapping from the colors and images that we see with the MUSE stuff to convincing H&E-like appearance. But I'll show you stuff that we've done the old way first. So I'm now going to just show you some pictures of different things that we've seen with MUSE. So this, for example, we're looking at a normal thyroid on the left and papillary carcinoma of the thyroid on the right of each field. The one on the left is standard FFPE. The one on the right is a thick specimen of MUSE, so it's not cut, it's just a cut surface of a thick piece. And you can see the regions of cancer and the regions of normal are shown. And you already get a sense that there's a bigger color gamut on the MUSE thing than with H&E. But if you insist, we can convert that to look like H&E, and then you can still see the distinction between the normal thyroid and the papillary carcinoma. One of the nice things, as I said, it can work with fresh tissue or fixed tissue, but we took it even further. This was a piece of prostate that for some reason had been a sort of a core section taken out of a whole prostate. And it's just sat around in RPMI or DMEM at 4 degrees in the refrigerator for 10 days. So no fixation, no freezing. This is what it looks like after 10 days just sitting in the fridge. And it doesn't look bad, and it still looks even better. So that one on the right is the color conversion of the one on the left, same image. What you see right in the middle here is a nerve, and there's cancer and lots of smooth muscle all over the place. That's a pretty convincing image of prostate, and it just stuck in the fridge for a week. What's fun, and we haven't done enough of it, is that we see some wonderful stuff with smooth muscle or connective tissue tumors. So here is something in the, I can't remember now what this is, but I think it's a GIST, gastrointestinal stromal tumor. And although we haven't pursued it, I think we're looking at some of the pseudovasculature that's found in GIST tumors that convey blood but aren't formed with endothelial cells. And so you can get a very nice sort of appreciation of how these things organize themselves. Now, we've started a lot of work study, making sure that, or comparing MUSE versus frozen sections, because one of the great sort of storylines here is that we can use MUSE and in 2 or 3 minutes get an intraoperative readout that's faster and easier than doing a 20-minute frozen section, and avoid all of the artifacts that you see with freezing. And I don't have sort of the good pictures, but I do have one comparison for you here. The left images are from fresh tissue from a squamous cell carcinoma with a tonsil, and then the right is the frozen section equivalent. And the only point to be made here really is that the cytology, the nuclear morphology, is really well preserved in the MUSE, and it's very hard to appreciate properly in the frozen section. But we also don't, and not shown here, but we also don't see horrible freezing artifacts, and we can image fat quite well where it's very hard to do that on frozen. So this is a developing story, but I think it's going to be a very important one. I kicked and screamed while we were trying to get this published. It was published in Nature Biomedical Engineering, and the reviewers kept saying, well, do a study, show us it's good. And I said, no, I don't want to. It's obvious it's good. So finally, I broke down and we did a quick study looking at the 42 cases more or less randomly taken from the operating room. And it was really actually, even though it was an informal study, it was quite rigorous, because these 42 cases, one pathologist saw only the MUSE image, the other pathologist saw only the H&E image. They had no clinical history, and they had to write down their diagnosis, and then we compared what they wrote down. And you can see that 39 out of 42 were identical, close were 2 out of 42, and in one case, acknowledged in retrospect, a pathologist screwed up and gave the wrong image, gave the wrong diagnosis. And we reported that in the paper, but we didn't name him. So what this means is that, just sort of in workflow, it means you can get a diagnosis in minutes instead of days. And so if you can imagine how that might play out in various workflows, not only for frozen sections, but simple patient management, get a biopsy, and then you know right away whether it's cancer or not. You can send the patient home. You can schedule more visits without waiting for the day or the week, depending on where what the logistics are. The other important thing about MUSE is that it's non-destructive. So if you're given tiny little needle biopsies, as you've heard already today, every time you make a slide, you lose tissue, and you can see how this tissue goes from this much to this much. And if you then have to scrape that off and get RNA and DNA and do IHC and fish, you're in a world of hurt. So it would be nice to be able to do all of your morphology and then still have the intact tissue left to do DNA and stuff. And we've already shown that doing MUSE has no effect on subsequent H&E, no effect on fish, no effect on IHC, and we just are continuing a study looking at the effect of MUSE on RNA-seq, and the preliminary results are there is none, which is good news. So hopefully this will be, you know, an acceptable tool for many, many different downstream assays. The other nice thing about MUSE, as I mentioned already, it can be large fields of view. So here is a look at a whole spinal cord from an unfortunate youth in a car accident. And so it's multiple fields stitched together, and you can see it stitches nicely. If you zoom in, you can see close-up of the motor neurons. This blue stuff here is the leptomeninges, and although you can't see it very well here, this is a peripheral nerve, and you can actually see the nodes of Ranvier longitudinally down the individual nerve fibers. It's nice for toxicology, so we're starting a study to look at neurotoxicology, chemotherapy, and nerve damage. And so this is an unfortunate rat's sciatic, is that what I mean? Sciatic nerve. And you can see the individual myelin sheaths, and also what's nice is that you can see the actual surface of the sheath outside the nerve, this very, very fine layer of cells surrounding it that would be almost impossible to capture with conventional histology. Here's a pretty picture of skin. Several points here. One, it's from a pigmented individual, so here's the melanin right here at the dermal epidermal junction. But the other thing is that you can see the elastin again. So for people who are very interested in elastosis or fibrotic processes, you get this for free. No special stains. So here's another challenge. What is this? Well, it's not what I thought. It's not a mitochondrion because that's a way wrong size. This is a mouse small bowel, ileum, I think. And it's really rather pretty. And if you zoom in, you can see the two different muscle layers and a nerve ganglion right here. And we've started actually to use this to look for ganglion problems in Hirschsprung's disease very rapidly. It turns out one of our stains actually highlights the ganglion cells rather dramatically. So here's another challenge for you. Well, this is a large vessel. Here's another vessel. This is a nerve. This is fat. The diagnosis is Italian sausage. So this was taken by one of the high school students, and it helped precipitate my flight into vegetarianism. Here's another question. Anyone want to hazard a guess as to what this is? It's a ganglion, and found in a different sausage. So there you are. So I think my last slide from the MUSE part of this story is to show you a direction that we're going in. This is very preliminary, but it turns out that we can, because MUSE has limited depth penetration, you can do serial block face imaging and get indefinite 3D images of structures. Even I overheard you were talking about looking at glomeruli. We should be able to section through glomeruli and get a 3D view of them because we can section 5 microns and image every time. And so here is just a rather gross series of slices because it's, I think, every